Cadaver is sponsored by Med School Tutors. Without further ado, welcome to the 74th Annual Step 1 Games.
I'm Katniss Everdeen. My name's Harrelson Abernathy. I've been assigned to be your mentor.
I don't need a mentor. I'll win this on my own and overthrow President Snow.
Don't kid yourself. Some of these people have been studying all their lives for this day. Take my advice and use med school tutors. Their personalized one-on-one tutoring will make sure the odds are ever in your favor.
Sounds too good to be true.
How do you think I got through my exam?
I'll check them out. By the way, I loved you in True Detective.
What? Every hero needs a mentor. Let med school tutors be part of your origin story.
Together, we can save the world.
My first time?
My first big exam. My first surgery.
Oh yeah, that was crazy.
I didn't know if I would stay. My first intubation.
My first real patient.
My first lumbar puncture.
My first suture.
Oh, yeah, my first cadaver.
If you're going to do a segment on women as physicians, I'll tell you a couple of great sexual harassment stories that I have.
If I had a tenth of a penny for every time that I was referred to as a nurse, as a dietitian, as a social worker, as darling, as honey, as sweetheart.
I baked up big bags of chocolate chip cookies, and instead of starting fights, I try to make friends.
It's very hard to walk that line between not being a bitch, but also not being a doormat.
After a terrible car crash, a boy is rushed to the hospital for emergency surgery. The surgeon takes one look at the patient and says, "I can't operate on the boy. He's my son." Yet the doctor is not the boy's father. How could that be? Despite the fact that I was surrounded by women in medicine, I remember hearing this riddle when I was a kid and thinking, wait, is it his stepdad? In all honesty, I've been really excited to share this episode with you all because it's a topic that's near and dear to my heart. Because guess what? It's hard being a female physician. Yes, it is 2015, and rather unfortunately, it seems some things are pretty hard to change. But don't listen to me. These women can speak for themselves.
More and more women are entering medicine as physicians. That being said, it is still very much a male-dominated field, and that creates a lot of conflict, as you may imagine.
That's Dr. Patsy Bowman Aiken.
Medicine is very hierarchical. To this day, it completely drives my husband crazy. He just doesn't understand it because, other professions are not like that anymore. Medicine still is. The attending is the attending. The senior resident is the senior. You have a very specific pecking order. And if you don't adhere to that, it does not go well for you or for the people around you.
There's a lot more women going to medicine these days. I think I've even seen statistics that a lot of medical school classes are now majority female, which, I think is great. But at the same time, the establishment is still very much male. The hierarchy is still very much with men in the most powerful positions and in the most quote-unquote procedure specialties.
That's Dr. Zina Semenovskaya.
I think society as a whole still, even in 2015, tends to look at male, especially, white, tall men, as sort of these dominant forces and women as lesser. And it's very frustrating. I try not to let it bother me. I try to just joke about it and go about my day. But there's a lot of stuff that happens that's really frustrating. Like I remember even as a medical student, I was treated horribly, particularly by the nurses, by the female nurses, because I was seen as competition for the males. So they'd be really, really nice to the male residents, the male doctors, helping them out, smiling at them, winking, flirting, and just really be mean to me. And the same thing happened when I was in residency. Although I remember when I was in residency, my residency was at a predominantly African-American hospital where most of the patients were African-American or immigrants from the Caribbean or parts of Africa. And the vast majority of the nurses who work there are also from that community. And, of course, are mostly female as well. And I remember one of my co-residents, who was an African-American female, said to me, the only thing that's worse than being a female resident is being a black female resident. She's like, because as horrible as they are to you, they're even worse to me. And there's a lot of hazing that goes on there. And I don't know exactly why women get hazed so much more than men. I think, maybe part of it is the sense of, competition between different women and this cattiness. But I think part of it also is that, there's just this societal it's an ingrained thing. I don't think it's even conscious, where people just look at men as the ones in charge and as the ones that have authority. And I can't tell you how many times I've now, as an attending, walked into a room and I have my ID that says physician on it, and I introduce myself as, hi, I go by Dr. Zina because Semenovskaya is too long. I'm Dr. Zina, I'm the attending, and I start running things, and I might have a medical student with me who's tall and male, and he's quiet. He's not saying anything. Maybe I'm even giving him orders and saying, hey, go do this, get me this, I need help with that. And everybody turns to him. The patient, the family turns to him and says, oh, doctor, and I'm the nurse. It just automatically. And I don't think it's intentional. I think it's just kind of where the mind goes. And again, I try to make light of it. I'm like, yes, doctor, you run things. I'm going to go get a coffee. You talk to them. They like you better. But, it's hurtful. And it definitely interferes with things.
If I had a penny, half a penny, a tenth of a penny for every time that I was referred to as a nurse, as a dietitian, as a social worker, as darling, as honey, as sweetheart, I would be cush. I would be in good shape, which is baseline. I don't have a problem with that. I roll with it. As long as people aren't calling me bad names, I'm okay. But I will say that for the amount of sacrifice and work and effort that has gone into my education and my training, it does kind of sting when you walk into a room, and even if you have doctor written on your white coat, it's on your badge. I try to carry myself professionally and with authority, and to still not get credit, so to speak, for being the doctor can be really frustrating. I had one situation when I was a resident when I was on call in the cardiac intensive care unit, and I had been up for 29 hours, and I was busy pre-rounding because the cardiologist attending was going to be coming on the unit, and we were going to be going through all the patients. And so I was running around, and I was standing at one of the nurses' stations, and I overheard a nurse talking to a patient in one of the bays, and he was waiting to have a procedure done, and I had not seen him yet. And I overheard her saying to him, Dr. Aiken is going to come in, and she's in scrubs, but she doesn't look like a doctor. And you're going to think that she's like, oh gosh, I don't know, maybe, a volunteer or the dietitian, but she's your doctor. And I just started laughing, and I was so tired at that point that I couldn't even get offended. And I walk in as she's saying this, and they both turn and look at me, and she says, see, that's her there right now. That's your doctor. And the patient looks at me and says, yeah, you're right. She doesn't look like my doctor. And I said, well, it's very nice to meet you. I am, in fact, Dr. Aiken. And, I carry forward. But, a lot of my male colleagues don't have to really deal with that.
It isn't even just that people act that way. I think that we treat ourselves that way. I mean, again, I've been in attending for 2 years, and I feel, fairly confident in my skills and my knowledge base. And just the other day, I found myself having it's a professional argument with a physician, a male physician, a little bit older from a different specialty, and we disagreed on the treatment for a patient. And I found myself, even though I was very, very certain that I was right, and I really wanted to advocate on the patient's behalf for what I thought the correct treatment would be, I found myself backing down and just kind of agreeing with him. And really, because he's an older guy, and he stood over me, and he said what he thought, and he kind of looked at me dismissively, and I sort of accepted that. And then, later I actually called him back and said, no, we're still going to do this. But in the moment, in that sort of physical confrontation, I definitely, reacted that way. And it's so weird because I'm definitely a feminist, and I've been doing this for a little while, and still it's there. This behavior it's so ingrained. It's there, and it sucks. And again, I really don't think that people do it intentionally or out of malice. The majority of the time, I think it's just maybe cultural and just so ingrained in us. People just have these stereotypes that they jump to. It happens all the time. And it's not even just between doctors and nurses. Like about a couple of months ago, I had a disagreement with my boss, who's a white male, and he's a great guy. He's a wonderful guy, and we had a disagreement. We had a little bit of like a heated discussion, and I felt that the way in which he spoke to me, I actually thought was very rude and dismissive. And so, a few weeks later, after the issue had been resolved and everything had been and we'd been moved on, I brought this up to him. I said to him, the way that you spoke to me the other day, I really felt kind of dismissive, and I didn't think it was really appropriate at all. And his response to me was, well, that's just how I argue. He's like, for example, he literally says to me, when I argue with my wife, that's what I say to her. And I said to him, well, what does arguing with your wife have to do with the way that you speak to me? Would you say to a male colleague who was upset with the way that you spoke to him, well, when I argue with my brother, that's how that just seems completely inappropriate, where I'm just sort of lumped together with his wife, and the way he would talk to her is the way he would talk to me. That seems completely crazy, but he thought nothing of that. And so I think it's just so pervasive. People don't even realize it's a problem.
I truly, truly believe that it's much harder as a woman to go through this whole process.
That's Dr. Scott Bader, a pediatrician and graduate of the State University of New York Health Science Center at Syracuse.
And I think part of it, and I got to look at it from I guess, a residency standpoint, I definitely saw this more. Because the majority of the nurses in the hospital are women, I've always seen a difference in terms of how they interact with the male physicians versus how they act with the female physicians. They will never give at times as much respect, or they always make the women physicians work harder for it. And that's the one thing. And I saw my wife has to deal with that. Same people that I felt like I never had any problems with would drive her nuts. And it wasn't just her. It was other female residents that I had worked with and stuff like that. I could see my interactions being so much different than their interactions with the nurses. And now, when I went through college, I had two very close friends who were nurses, and they beat into me very early on that if you want to survive medical school residency and be a good doctor, you have to take good care of your nurses, and that's probably one of the most important lessons you learn very early on in the whole process.
As part of my training as a cardiothoracic anesthesia fellow, I was supposed to be in charge of the intensive care unit.
That's Dr. Haren Dane.
Now, walking into the cardiothoracic intensive care unit, a young resident, much younger than the nurses there have been nurses there for 30 years. So imagine me suggesting something to a nurse who's been there for 30 years when I'm a young female coming in for the first time, my first week in the intensive care unit, telling them orders, giving them suggestions. You can imagine how anything I have to say is poo-pooed as you don't know really what you're talking about. And I've gotten that a lot. Even when I started as a new anesthesiologist. How long have you been doing this for? They ask me. So a lot of it is really trying to just establish credit and just keep doing what you do and just doing it well. And then over time, people start to realize that you know what you're doing and just kind of not letting them get to you, not letting them see you sweat pretty much. I had to win the nurses over in the cardiothoracic unit. I decided on my second day being there that there was no way that I was going to survive unless I could try to make friends with these nurses. So I went home and I baked up a big batch of chocolate chip cookies, and I came in the next day, and instead of starting fights, I tried to make friends. And I brought in the cookies, and the nurses loved them, and I started winning people over, and it got a lot easier.
If you're going to do a segment on women as physicians, I'll tell you a couple of great sexual harassment stories that I have okay. that were just for like, what? So there was a nurse at the hospital where I did my residency, and I remember once I asked him to place an IV in a patient's arm for me. And he said, okay. And then when I walked by the patient a little while later, I saw that the IV was in. I was really happy because it was a very difficult IV placement. And when I saw the nurse, a while after that, I said to him, oh, hey, thanks so much for putting that IV in for me. And without missing a beat, he replies, oh, that's not the only thing I can put in you. And I just look at him, and I'm just like, what? Like, I'm just stunned by this comment. And then when I told other people that he said this to me, instead of like outrage or like, oh my God, that's ridiculous, you should report him, they just laughed. They're like, oh yeah, he's probably just flirting. And then another time I asked him same nurse, to get me a bottle of this anesthetic, just a very small bottle that I needed. And he got it for me, but he actually got me a much larger bottle than what I'd asked for. And so when I saw him, I said, oh, thanks, but, I just needed the small one. I didn't need the whole large bottle. And he says to me, yeah. He's like, well, you can handle the big one. With a wink. And again, I just looked at him like, I'm sorry, what? But this was just okay. This was just somehow okay. This was not something you report. It's just something you laugh about. And people were like, oh, but it's almost like a compliment. He's flirting with you. He probably thinks you're sexy. And I'm like, no. I think we're missing something here. There's something that's missing where I think this is really awful, but nobody else seems to think this is wrong. So, and stuff like that happens all the time. Just recently had a nurse at the hospital where I work now, the one in Brooklyn, tell me that, if you're going to work here, you're going to have to wear bigger pants. And, I wear scrubs to work usually. And I'm like, I don't understand what you're saying. I'm like, are you saying that I'm fat? Like, I don't really understand. What do you mean bigger pants? These pants fit me just fine. And I don't even know why I even responded to that comment, but I was just so perplexed. And he said to me, he's like, yeah, you are fine in those pants, and laughed. And I was like, so is he just checking out my ass and the comment that I shouldn't wear scrubs that are quite so tight? I mean, it was crazy, but this was just okay. He said this to me just out in the open in front of everybody. And this is just baffling to me. And you can't really do anything about it, because if I make a big deal about it, then now I'm this person that nobody wants to deal with. So you just kind of have to laugh it off. But, it's 2015. It's still going on.
I felt like I had a harder time with older nurses, not so much the young ones. I could relate to the young ones. The older ones were harder to win over because until you proved your ability, they believed you didn't know what the hell you were doing. And I also had trouble with the men, because the men, and I still get this sometimes, they just think I'm pretty. I may be pretty, but I also have something to contribute here. I want you to listen to what I have to say, because what I have to say will help our patient and will contribute to our patient's well-being. And I wind up a lot of times acquiescing and making jokes in the operating room. As a medical student, I remember one particular rotation that I was on in medicine, and I was trying to learn as much as I could. I was trying to absorb as much as I could on this rotation. I was really interested in internal medicine at the time. And it was very difficult to try to learn and try to shine when one of the attendings was too busy looking at your legs to really be, a contributory part of your education. I wound up having to start wearing really long skirts and nothing that was revealing. I was trying to detract from my looks so that I can get a better education. And, you do what you have to do. I hate to say it, but, you're really the only one looking out for yourself. So instead of reporting him or making waves, which I guess I could have done, I did the opposite, which was I just tried to take matters into my own hands and finagle through it, and then really try to get people to listen to me for what comes out of my mouth as opposed to just looking at me.
The other physician I was speaking with was saying that when she first started as an intern, she actually stopped wearing makeup and she stopped putting herself together as prettily as she normally would have to try to be less of a threat.
Absolutely. Yeah. But it goes both ways. If a female physician is overweight or maybe less attractive or doesn't seem to take the best, care about her appearance, she's seen in a very derogatory manner. People make all kinds of snarky comments about her, which of course she's a doctor because she can't find a man, that sort of thing. And if someone is attractive, then they don't take her seriously. And the same even goes about your attitude. If a male physician says something authoritatively, maybe presses an issue, maybe says, no, we're going to do it this way, this is how we're running things, etc., people think of him as strong. If a woman does that, she's a bitch. But if a woman doesn't do that and steps back and is nice and polite and tries to be liked, which is basically, what we're sort of taught to do from childhood, then she's basically just stepped on and not taken seriously. And so it's very hard to walk that line between not being a bitch but also not being a doormat. I think that's probably true in just general society as well, but for sure in the hospital. And that's also very frustrating because at some point you just make a decision. You say, you know what, I don't care. I'm not here to make best friends. I'm here to do a good job and to do it well. And this is how I'm going to be. And I just kind of hope for the best. Yeah. And it's very, very hard, especially if, your whole life you've always been this kind of like nice, sweet person. And suddenly you have to step it up and just not be that nice, sweet person because then you can't do your job.
I've kind of gotten to a point in my life since I'm not 25 anymore. I'm older. I have kids. I have other responsibilities. I have other things I worry about beyond just, what's going on within the hospital. I am tougher, and I can take a lot, and I'm very sweet, and I smile and all that. But beyond a certain point, if you push me, it will not go well. And I think it's very important for women in medicine, female physicians, to make that clear. I don't think you have to run around and try to be a guy. I don't think you have to run around and try to, put people in their place or anything like that. But I do think that in order to maintain a level of authority, you have to have a backbone and you have to have a thick skin. I had a team when I was up bureau level resident, and we had 3 med students on the team, 2 of which were young men and 1 was a young woman. The young woman by far was more prepared, knew her stuff better. And the 2 guys were very capable, but she was clearly on her game more. But she was very timid, and she wouldn't really look you in the eye when she was presenting a patient. She was very timid around the nurses, and so she got pushed around, and she wasn't taken very seriously. And meanwhile, the guys, they handled themselves with confidence. They looked people in the eye. They shook, firm handshake, whole bit. They were getting more positive feedback. And so I took the young woman aside, and I was like, look, you have every reason to be large and in charge here. You need to take ownership of that. You cannot let people push you around. I will sing your praises on your evaluation, but you need to earn it. And by earning it, you've earned it in terms of your clinical acumen, your preparation for rounds. But you need to stand with a straighter spine. You need to look people in the eye, and you need to own your space and own your territory. And you need to show these guys that you're way better than them. And I feel like initially it was difficult for her. She was with me for 4 weeks, and the first 2 weeks were a little rocky. But I hope that I was able to mentor her in a way that put her on a better trajectory with her medical career. Because by the end of the 4 weeks, she was clearly getting the attention of the attendings. The nurses were not picking on her anymore, and she was owning her space. And I felt like that was really important.
Let's go to Dr. Emma Husain.
Ironically, this is a good story. Because I did orthopedics in Canada, Canada has an exchange program with Saudi Arabia, and their residents, so the medical school graduates from the Saudi universities, can come and train in Canada. And Saudi government pays our government, and they pay the residents. So we get free residents. We don't pay them, and they're working for the benefit of working in English in, North American hospital. And so I would say that a third of the residents were Saudi men, of course, only men. And it's really funny because I thought, Saudi Arabia is obviously the most strict Islamic country in the world. And, for good reasons, it's got all the holy sites and everything. And they're very, very strict, and the most traditional with respect to women's roles. And for some reason, I think it's the Muslim last name and the fact that every man has a daughter or a mother. But those were my guys. Those were the ones that I didn't necessarily have heart-to-heart talks with them because that's not how they roll. But what they did was they constantly protected me, constantly got me to operate, always had me go try this, do this, do this, do this, paged me if there was something cool and I was somewhere else doing, scut work on the ward. Oh, you have to come down here and see this. And it was the most unusual, I think, place to get support for a North American female. But I felt incredibly protected and cared for by those men. But I didn't have any friends because my peers were men, and they were very macho men, and it was wasn't I'm sure there was respect, but there wasn't really any friendship. So yeah, from Saudi Arabia with love.
One of the great things about women as physicians is that we do bring a different skill set to the table. And I do think that many times the female mindset is they're more adept at being empathic or, really taking a moment to listen to what people are saying and trying to establish eye contact and put people at ease. So I think that if you can combine that element, I hate to just sort of chalk it up to that maternal thing because I don't think it's that, but an ability to connect with people on a more personal level with being able to be authoritative and make decisions, I think that's really important.
Yeah, and that's the only thing. At the end of the day, what makes me feel better is that, it's not about me. It's not about how I feel. It's not about my interaction with this particular nurse or physician. It's about the patients, taking good care of them, and not letting anything get in the way of that. And that's just what I have to do, and that's it. But it's hard. Sometimes I come home and I'm like, what the heck am I doing with my life? All these years of education, and I come into a job where I just fight all day with people and get sexually harassed. What am I doing with my life, But the people in those situations, those patients tend to need the most help and the most care. And so, you just kind of suck it up and go back to work.
Well, I guess I would just say, you've worked this hard and come this far that you just can't let people get in your way. And you don't have to do it by being mean or arrogant or conniving, but you can kill them with kindness, show them that you know what you're talking about, and I think you can gain people's trust and accolades and respect by being yourself, and I would say you get further with honey than you do vinegar.
One maybe last thing to remember as a med student, really important, is happy people don't treat other people badly. If somebody's treating you badly, it's because they're unhappy. Because I've never been mean to anybody unless I was in a really bad mood or things were really going wrong in my life. And, people make mistakes and I could be maybe unhappy with them. But I don't think I ever treated anyone badly when I was happy. And if you're being treated badly as a medical student, okay, A, it's kind of par for the course. And B, the person that's hurting you is in a lot of pain if they're hurting you that much. So that's not for you to fix, and it's not for you to even care about, but it is for you to realize all these mean things that were said, it's not completely about you, even though they were all said about you. It's about the person that was being that mean, and understand that, you are not necessarily responsible for all the things that are said and done to you. The other person has a huge responsibility in that. And unhappy people treat other people badly. And I think that we can all think of some amazing doctor that treated everybody with kindness and respect and had a good word for everyone and breezed through their rounds, spreading love and joy. And those people did the same job without making you feel like a jackass. And it's because of who they are and the life that they're living. It's not all about you. So yeah, every bad day, every time someone says, I can't believe you made it through med school, or what are you even doing here? Or you don't know this? I can't, how can I, whatever they say is, it's, you might have screwed up, but it's still not about you.
For this episode, I struggled with what I wanted to say for our intro and outro, and I just realized why. Because these doctors can clearly speak for themselves, and as you know, despite my childhood dreams, I am not a physician, just your humble podcast host. However, the problems women face in medicine in many ways seem to mirror the issues we collectively face as women in the world at large today. So we must keep making stories of our own, and live our way into the answer by pushing boundaries, speaking up, and challenging old ideas. I mean, really, we can do this. Thank you to Dr. Zina Semenovskaya, Patsy Bowman Aiken, Haren Dane, Scott Bader, and Emma Husain. The My First Cadaver team, Papa Claire Music and Compulsion Music, our nerf-blasting friends at Salt and Stone, and special thanks to Robert Meekins, who is not a doctor. Happy Chris Mahana Kwanzaa from the My First Cadaver team. Thank you for making our first season such a delight. We'll kick off the new year with episode 9, coming soon in 2016. And remember, guys, please use a sturdy ladder when you're hanging your holiday lights, or you could become someone's first cadaver.
Actually, I do this presentation about urological emergencies, and the title of my presentation is a joke. It says it's my favorite chief complaint, the chief complaint being, "Yo, miss, I got some shit on my junk. You want to look at it?" That's literally what somebody will say to me when they have a problem with their genitals, you know? It's actually what I've heard said to me many times. But I'm the doctor. I can't say, no, I don't. You're discharged. You know? I mean, what can I do? I do have to look at it. So you're kind of stuck in this place where I reprimand the patient, so you shouldn't talk to me like that. You know, it doesn't get you anywhere. Very frustrating.